Welcome to your new health segment, Doctors on Call. In this segment, we will discuss common health issues, myths, and newer advances in healthcare, all backed by scientific data. I'm your host, Dr. Sameer Gupta, a cardiologist.
And I'm your co-host, Dr. Sonia Lal Gupta, a neurologist. Last week we discussed on what is obesity, how it affects our body, and how diet and exercise can help us lose weight. This week we will discuss on how in some cases medicines and surgeries can be used to treat obesity. As we discussed last week, obesity is the accumulation of excess fat in our body. Body mass index or BMI is the most commonly used measure to identify obesity. Indians are found to have diabetes and high blood pressure at lower BMIs as compared to Western countries. Hence, a BMI above 25 is considered to be obese in India. Obesity can increase the risk of heart disease, stroke, and even cancer. In cases where diet and exercise are difficult to follow or are ineffective, your doctor may consider other options. To know more, we spoke to Dr. Pradeep Chaube, Senior Bariatric Surgeon.
If it doesn't work, then the physicians and the doctors come into play and they add some tablets, some medicines, etc. into this. But one thing is very sure, that when we are giving medications to these patients, it should be under supervision of a professional. Then of course, if all these things doesn't work, then the top of the pyramid ultimately remains the bariatric surgery. Now in India, the importance of obesity is the correlation with diabetes. These patients do need to continue supplements which are very simple, B complex, calcium and vitamin D and iron. So there is nothing much about it, and these are all supplements which person can continue, and it provides, this is bariatric surgery in diabetic patients and metabolic patients, in the patients who have got high cholesterol levels, is a big blessing.
Like Dr. Chaube mentioned, diet and exercise do not work for everyone, and sometimes surgery may be needed. We talked to Gurpreet Singh, who had one such surgery.
मैं बचपन से ही मेरा वेट बहुत ज़्यादा रहता था. मैंने कई बार एक्सरसाइज करके अपना वेट लॉस करने की कोशिश की, लेकिन मेरा वेट लॉस नहीं होता था. 20 इयर्स की एज में मेरे को शुगर की प्रॉब्लम होगी, जो कि मेरा HbA1c 10.6 तक चला गया था. आज से तकरीबन 3.5 साल पहले मैंने ऑपरेशन कराया. उसका फर्स्ट डे से ही मेरी शुगर की प्रॉब्लम ख़त्म हो गई. अब मैं इस समय कोई इंसुलिन नहीं लगाता और ना ही कोई इसके लिए मेडिसिन खाता हूँ. ऑपरेशन कराने के बाद मेरा वेट लॉस होने से मैं बहुत अच्छा बेटर फील करता हूँ, और मेरे को अब इससे कोई प्रॉब्लम्स नहीं.
The criteria for people who can qualify for bariatric surgery based on BMI are as follows. A BMI above 32.5 with diabetes, or a BMI above 37.5 without diabetes. Now, bariatric surgery is divided into three main types: restrictive, malabsorptive, or combination. Currently, mainly restrictive and combination surgeries are being done in India. Gastric sleeve is the most common type of restrictive surgery. In gastric sleeve surgery, a section of the stomach is removed and then sealed, decreasing the size of the stomach. A small stomach can hold lesser food, so you feel full with lesser food compared to before. And basically, you take lesser calories. Now you eat lesser calories and lose weight. Gastric bypass or Roux-en-Y procedure is the most common type of combination surgery. In this surgery, a small pouch is made on top of the stomach, which decreases the size of how much food can be taken. It is then connected directly to the small intestine, decreasing absorption of calories and hence weight loss. The most common long-term side effect of bariatric surgery is decreased absorption of vitamins and minerals. So multivitamins and nutrition supplements are recommended to be taken lifelong after surgery.
These surgeries, depending on what is done, can help you lose 55 to 70% of your weight. For people who are morbidly obese and those who have uncontrolled diabetes, bariatric surgery can be a good option.
It is important to remember that people who meet criteria for surgery have to undergo extensive pre-evaluation before actually qualifying for the surgery.
Remember, a healthy diet and regular exercise are key to keep your weight under control and should always be the first option.
So let us start early and give good habits to our children to prevent them from getting obese. See you next week on another health segment. Till then, stay happy, stay healthy.